Diabetes Family Education, Ongoing Care and Follow-Up for Type 1 Diabetes by the Diabetes Education Program at the Hospital for Sick Children. This resource outlines what is often included in long-term follow-up care for people with Type 1 diabetes. Please note, the images in this resource are for illustrative purposes only and do not constitute the hospital's endorsement of a specific brand or product. Follow-up care. Diabetes is a lifelong condition that can be managed. You will get to know your diabetes team well, and together you can work on keeping your blood sugar levels within a healthy range. Regular visits with your healthcare team are important to stay on track. You will have appointments every 3 months up until you are 18 years of age. After this time, you will be referred to an adult endocrinologist. The goals of regular clinic visits are to check in to see how your diabetes management is going. We will look at your overall blood sugar control, your day-to-day management routines, and doing screening tests for possible diabetes-related issues. You will work with your team to make changes to your diabetes care at different stages to support your development physically, emotionally, and socially. And we will update you about advancements in diabetes care, such as management changes, research, and educational opportunities. Before each appointment, upload information from your devices, including your blood sugar meter, sensor, and/or insulin pump. If you are unable to upload the information, be sure to bring your diabetes devices with you to your appointment. Some of the appointments may be virtual visits. For this type of visit, you may need to prepare by getting blood work done in the community. It could take a few days for the diabetes team to get the results. To have a successful virtual visit, make sure the data from your device is uploaded. The child/teen needs to be present during the appointment with the camera turned on. You will need to bring the following with you to each appointment: a list of prescriptions you need. Be sure to check with your pharmacy about which prescriptions need renewing before your appointment. Current insulin doses, any forms you need signed, and your questions. Once you check in for your appointment, you may meet the following people: a phlebotomist or blood work lab technician, a nurse, a dietitian, an endocrinologist or diabetes doctor, a resident or clinical fellow, these are doctors in specialized training, and a social worker. Let's look at what each of these team members will help you with. The phlebotomist will take blood samples, including for the HbA1c level, which is taken by finger poke. Venipuncture, blood work from a vein, is done less often. These tests and needle pokes are important for long-term health. Ask your team about techniques that help children through painful procedures by using numbing cream, comfort positioning, and distraction techniques. The nurse will meet with you to understand how you have been managing your diabetes since your last visit. They will ask if there are specific things you would like to talk about, and they will share strategies to help you improve your diabetes management. At this time, you will also have your height, weight, and blood pressure measured. The dietitian will help you understand how food is a part of your diabetes care and will help with your dietary needs. The pediatric endocrinologist will talk with you about how you have been managing your diabetes at home. They will make recommendations to help you care for your diabetes. A medical resident or fellow will be a part of your diabetes visit. The resident or fellow works with an endocrinologist. You will often meet with them first to describe how you take care of your diabetes at home. The social worker will help you adjust to the various challenges you might face by listening and helping you to process your feelings, supporting you and your child through the adjustment to this new normal, helping to navigate and connect you to community and financial resources, discussing issues that might come up during life stage transitions, and helping you to work through diabetes distress. There are a few conditions that are often associated with type 1 diabetes that you should be aware of. Children with an autoimmune condition, such as type 1 diabetes, are more at risk to have additional autoimmune conditions, such as thyroid irregularities, celiac disease. Let's look at thyroid conditions first. The thyroid is a gland located in the middle of the lower front of the neck. It produces thyroid hormones that are important for growth, body temperature control, digestion, body weight, and mood. Thyroid irregularities will develop in 20% to 25% of people with type 1 diabetes. Thyroid conditions include hypothyroidism and hyperthyroidism. Hypothyroidism, or Hashimoto's thyroiditis, is when the thyroid gland does not make enough thyroid hormone. This is more common than hyperthyroidism in people with type 1 diabetes. Symptoms include weight gain, slower growth, problems concentrating, dry skin and hair, constipation, cold intolerance, and irregular menstrual periods. Treatment for hypothyroidism is an oral medication. Hyperthyroidism, or Graves' disease, is when the thyroid gland makes too much thyroid hormone. This is less common than not making enough hormone. Symptoms include weight loss, increased appetite, mood swings, shakiness and sweating, diarrhea, heat intolerance, and bulging eyes. Treatment for hyperthyroidism is an oral medication. Screening tests for thyroid problems include blood draw via venipuncture. It is done at initial diagnosis of diabetes and then every 2 years. If antithyroid antibodies are present, then it will be done every 6 to 12 months. Another associated condition is celiac disease. Celiac disease is a sensitivity to gluten, the major protein of wheat, rye, and barley. It affects the ability of the small intestine to absorb food nutrients. Common symptoms include belly pain, bloating, poor growth or weight gain, and loose, foul-smelling stools. Celiac disease occurs in 10% of children with type 1 diabetes. Treatment for celiac disease is to follow a gluten-free diet. Screening tests for celiac disease include blood draw via venipuncture. It is usually done after someone has had diabetes for 2 to 5 years. The test will be done sooner if there are signs of stomach upset, poor growth, poor weight gain, fatigue, and poor blood sugar control. Looking ahead. It's important to stay connected to your diabetes team by regularly attending clinic appointments and reaching out when you have questions. Remember, diabetes is a manageable condition. Your diabetes team is here to support you and your family's journey. For additional information, see these diabetes resources. We are here to help. If you have questions or need further tips, please contact your diabetes team.